Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Teledentistry is gaining popularity while many dental practices are closing during this COVID-19 pandemic. It allows patients to stay connected with their dentist without leaving home, thereby keeping people safe. Well, here to talk about this growing trend and how this trend is working is Dr. Sean Boynes. He's Vice President of Health Improvement at DentaQuest. Thank you for joining us, Dr. Boynes.
Thank you very much for having me.
Well, how has this pandemic put teledentistry in the spotlight, and what exactly is teledentistry?
Sure. I think much like medicine and behavioral health, the dentistry has also had to make some changes as the COVID pandemic has hit. And really, we're kind of seeing patients that want to engage with us in a different way. So teledentistry really is just a different way for us to reach out and touch someone, if you will, a different way to communicate. I don't know about you, Neil, but I was a big fan of the Jetsons when I was growing up, and I was always jealous of the fact that they were able to, meet their physicians and doctors in their house, in their living room, and they were able to communicate through TVs. And that's really what we're talking about here, is just a different way to communicate. I think we will continue to see this proliferate just because people are having we're seeing a really good process with this. And in fact, virtual health interactions are up almost 50%. We expect there to be 1 billion interactions by the end of 2020. And you mix that with the fact that about 35% of people say they've already missed a dental appointment. And this becomes a way for us to engage that while it's been around for a while, does seem new to many people.
Well, let's talk about, you mentioned the Jetsons. How close to that reality are we? When you think of dentistry, you think of hands-on, you think of mouths open, you think of anesthesia, you think of pulling teeth, you think of pain. How is all of that addressed via teledentistry?
So teledentistry right now is not going to be a replacement for going in and seeing the dentist. If you look at the Jetsons, they had these little robots that would clean your teeth. The Rosie robot would come over and take a tooth out and be instructed through the TV. We're not to that point yet, although who knows, we keep advancing technology. What it can do is offer a safe way to triage individuals. So if you have an emergency or you're in pain, we can determine the needs for care. In fact, there was just a recent report that was put out that showed about 40% of individuals who had a teledentistry encounter did not actually need to come in. And so they did not come in. They did not get that exposure risk to COVID, and they didn't waste their time. So I think that that's going to be pretty paramount to how we can be successful utilizing teledentistry and how really when you think about its impact, it really sits there.
What about teledentistry being used to access some of the underserved, maybe rural areas that people can't get in? Is this something that is going to allow better access in addition to efficiency in triage?
You're exactly right, and we're seeing that. So teledentistry is nothing new to us at DentaQuest. Been working with it for several years. We have pilot programs across the country that we've really either initiated or started, and we found that in rural environments, in places like nursing homes and assisted living facilities, that this really fits a gap in access to care. And you mix that in with understanding that there's good bacteria and bad bacteria in the mouth, and that we can talk about patients to talk about health, as opposed to whether they need a filling or whether they need a cleaning, but how to make their mouth healthier. And we're just seeing that dentistry is advancing with the technology to interact in a different way that may to some feel more medical in nature, as opposed to just getting a teeth cleaned or getting a drill put in the tooth.
Now, how is DentaQuest addressing some of the, fears that patients may have, going into teledentistry or being treated that or triaged that way? Many of us feel that, if I'm not hands-on with my dentist, maybe there's something lacking in care.
Right. So as I said, it's kind of a different way to interact. Doesn't mean that you're going to have a complete replacement for going in to see the dentist. But what I can tell you from our pilot programs that go out into communities, especially those that want access or just want convenience, that we find that individuals that have a telehealth visit or that individuals that have a risk assessment that's done outside of an exam or outside of a cleaning, they're less likely to need an emergency dental visit. They're less likely to need to have a filling or an extraction, more likely to have a preventive visit. And here's the good news for states that are feeling a crunch, especially on the Medicaid side. It reduces the cost of care by a significant amount, so it saves money.
What about beyond this pandemic? We're all talking about new normals, maybe even a normal as it was. I kind of doubt that. But what about beyond this pandemic? How do you think teledentistry is going to fare afterward?
So I do not think it's going away. We're already seeing results of people that like this as a medium. And we've seen in places like New York and in Arizona and in Florida increases in the use of telehealth really over the last 3 to 4 months. I think the other thing to think about is that telehealth may not just be something where you're reaching out in your home. You may actually be at the dental office having your oral health hygiene visit or your teeth cleaned. And the dentist, because of this increased cost of personal protective equipment that dentists are going to need to have to be safe and to keep individuals safe, they're going to be less likely to want to take off all of that personal protective equipment to go do what we call in the business a hygiene check. But as a patient, they may realize it as the dentist coming and checking or counting the teeth. That may actually occur between an inter-office telehealth visit, so that individuals will just connect that way within the office so that there's no increase of risk. This allows dental offices to maintain social distancing and keep people safe.
Now, and just to be clear, there are different types. There are all types of teledentistry. I mean, you don't have to be at a desktop or even a laptop. A lot of this can be done, on your phone, just like anything else having to do with the internet, right?
Correct. You can take pictures of your teeth utilizing your phone. We have better cameras now than we've had in the past. And those can be sent in. You have cameras on screen. And we're even seeing advancements in diagnostic. There's tools being looked at in Germany that allows for scanning of the mouth. They can find bacteria colonizations. And we're hearing about kiosks that may go up that can get dentures made using 3D printing in about an hour to 2 hours at about half the cost. And so I think really just what we're seeing is COVID is accelerating technology in a way because we need it, and we need to come up with new ways to provide care.
We'd like to learn much more about DentaQuest. Where can we go online and learn more about DentaQuest and teledentistry?
Sure. We have a website to go and peruse. It's DentaQuest.com. That DentaQuest is one swished together word, DentaQuest.com/teledentistry. DentaQuest.com, teledentistry, and put a slash in between.
Great. Sean, thank you so much for joining us here on Health Professional Radio this morning.
Neil, thank you so much. It's been wonderful. I appreciate that you care about the oral health of everyone.
You've been listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.